there's that bud comes out of your heart, and then all the arteries grow out, the arteries in your heart grow out, and then the arteries, your aorta, your carotid arteries, and then down to your kidney arteries, your leg arteries. So these are all blood vessels. And what we've done in medicine is we've compartmentalized everything. And then we break it up into different organs, so we don't see that there's a universal connection. So whether, if you have kidney disease, for example, well, what's wrong with your kidneys? Now, there are many different types of kidney disease, but the number one thing is still microvascular disease in your kidneys. So when you have high insulin levels, the tiny blood vessels in your kidneys are not going to work very well. They lose their ability to vasodilate. So insulin blocks nitric oxide production. Nitric oxide is a vasodilator, as you know. So when your nitric oxide is not there, you can't vasodilate. And the body is supposed to have this vasodilatory capacity. You're supposed to be vasodilate and vasoconstrict. And you're supposed to have that flexibility. But you immobilize all your tiny blood vessels and capillaries when your insulin level is high. So in your kidneys, you're not going to get adequate kidney function. In the brain, you're not going to have adequate brain function. You're going to get your major arteries will also clog up, your carotids, your peripheral vascular disease. So insulin affects every organ because every organ has blood supply, and you are as old as your blood supply. I mean, William Osler said that, right? You're as old as your arteries. So the manifestations of high insulin are widespread. So I'll give you an example. Some of my older patients come in and say, I'm getting a little demented, I'm getting very forgetful, and the spouse will say the same thing, and I will find hyperinsulinemia. And when I treat them, and I change their diet, and I'm just a cardiologist, but I tell them, look, you got to do the following thing. The wife will come in and say, you know what, his memory is so much better now. He's functioning better. And we now know that when you do magnetic resonance imaging studies in the brain and look at functional studies, that it's the vasodilation, vasoconstriction that occurs in your brain, in different parts of your brain. And you basically immobilize all that when your insulin levels are high. And insulin is a growth factor. That's something else that people do. So how does it cause hardening of the arteries? Well, the walls of your arteries have smooth muscles. Okay, that's why they can vasoconstrict and vasodilate. And what insulin does is that it causes that smooth muscle proliferation. So it causes it to thicken. So the walls of the arteries become thicker as well. So it's a growth factor. It also causes left ventricular hypertrophy. Big word. Basically, the heart muscle all muscles get a little fat when you put the patient on insulin or you have high insulin levels. So it's a growth factor. Growth factors also affect cancer and cancerous cells in the body. So a growth factor is something you want when you need it, but when you have an inappropriately high insulin level, you don't want those growth factors to be there. So take blood pressure.
Before Course Hero, I spent hours